Hello, Startup Vision. I'm Dr. Steven Hodak. I'm the Chief of Endocrinology at NYU Langone Tisch Hospital, and I'm glad to be with you today.
Hello, Steven. Thank you so much for being with us today.
My pleasure, Florence.
Hi. You are a renowned doctor, specialist at NYU Tisch Hospital in a city that was hit very, very hard by this terrible pandemic and that fought back, And now that almost every state is reopening, what can we do to stay on top of this terrible virus and stop the spread? And can we talk about the tests?
Sure, of course. So, the tests are important, but they aren't the only way we stay ahead of the virus and stay safe. The fundamental things that have always been true about this virus are still true. Washing your hands, avoiding sick contacts, not touching your face, and appropriate social distancing are still the keys to staying safe. The contagion of this virus is not magical. It happens from exposure. And one of the saddest things that I see are patients who are so petrified with fear because they don't understand that they can actually mitigate their risk for infection, that they effectively become homebound and they're paralyzed. They can't travel, and that's the wrong way to approach this too. You have to be smart. You have to avoid high-risk situations. But this virus really is fragile. It dies from soap and water. It dies from air exposure. It dies from sun exposure. So if you're cautious and not entering high-risk situations and you're taking those few basic precautions, you can do a lot to keep yourself healthy.
Yeah, but we hear on TV or everywhere, that this virus can stay in the air for like 8 minutes, 14 minutes. I mean, this is very scary.
Right. And so I think that the scientists and the other medical people have not necessarily done a great service to patients and to civilians by not being clearer about what that information means. Many of those studies about how long the virus lingers in the air were done in completely sterile research settings where there wasn't normal air circulation, where there wasn't normal sun exposure. So what happens in an environment that's the real world, where the air is moving, where you may be outside, where the sun may be around, where people are washing their hands, is a completely different story. And we know that this virus does not survive very simple things like disinfecting your hands with alcohol-based sanitizers and washing your hands with soap and water. So you can really impact your risk of infection just by those very simple and very easy to do things. And don't touch your face.
And do you mean, for example, I'm insisting because it's so important for people to understand, do you mean, for example, that if we open a window in our apartments, it helps? Do you mean that, being outside helps? That's what you said. Wearing a mask helps. That's what you mean?
So yeah, the question, so first of all, let me maybe answer in the order that you asked the question. So opening a window definitely helps. How much does it help? Nobody knows. But turbulent flowing air is clearly better than stagnant air and being enclosed in a room where there's very little air circulation. So yes, it helps. How much? No one really knows. And it's going to depend a lot on the degree of the air circulation. Wearing a mask is important, but there are different kinds of masks. So the cloth masks that people are wearing, the surgical masks that people are wearing, those masks mainly reduce your ability, the mask wearer's ability, to infect other people. It stops viruses from being directly expelled into the face or in the vicinity of someone else. It's less effective protecting you against infection when virus is around. To do that, you really need an N95 respirator, which has a material with pore sizes that are so small that viruses can't easily pass inside. So all these things are tools and they all help. There's no magic bullet, and there's no one thing that anyone can do to absolutely eliminate the risk of infection other than shutting yourself away, and that's not a good idea.
So let's talk about the tests now.
Sure. So we can talk about the test. There's a few different kinds of tests, but the main tests are the diagnostic tests, which are primarily the PCR, the preliminase chain reaction tests, or the antigen tests that are really built around detecting whether or not you are actively shedding virus. So whether you have an infection and the virus is present and can be expelled from your body. Those are the diagnostic tests. The more recent tests are the antibody tests that are looking to see if your body is manufacturing antibodies that we ultimately hope are protective antibodies because you've been exposed to the virus. So they're a little bit different in what they do, and their importance is different in different circumstances.
Yeah, but we hear also that, you know, they are not accurate. There are a lot of false negative. What does it mean? You know, what should we do? What
Right.
does?
So it's true that there are varying degrees of accuracy, and this is a big issue right now, especially with the antibody test. And it's because the antibody tests were developed and released effectively in a hurry to try to bring these tests to market because there's such a perceived value that they offer. But the consequence has been that many people have been developing tests. I think we have over 100 antibody tests that have now been developed by startups, by academic medical centers, by commercial labs, and they all have a different ability to detect the virus or to tell you that the virus is not present. Most of them are focused on being very high negative predictive value antibody tests, meaning that if you get a negative result, it's very likely that that negative result is correct. Where we're seeing far more difficulty with the antibody tests is that there's a much bigger false positive rate, meaning the test will be positive and suggest that you have an antibody to the coronavirus, to SARS-CoV-2, COVID-19 virus, when you actually don't. So that's what we're contending with now with antibody testing. The accuracy of the diagnostic tests, the PCR tests and the antigen tests are actually pretty good. And so those tests have a fairly low, almost zero false positive rate. If those tests are positive, you're infected.
So what are the hopes, and, you know, where are we in terms of vaccine and cure?
Right, so that's going to be a little ways off. So there are two different issues there. One is therapeutics. I'm sick, I have a disease, I have a virus, I need something to treat myself with so I get better. That's a therapeutic. The vaccine is a way of immunizing people. When you give people a vaccine, they develop an immunity to infection so they can't be infected. Where are we with vaccines? I think ultimately vaccines are going to be very important. I think we all agree about that. The problem is they don't happen quickly. Vaccines take a while for development. And having said that, there are some real paradigm shifts that are happening in vaccine development that I think will show that we can speed the process of vaccine development along. But it's unrealistic to think that this is going to happen any sooner than the next year. Even if a vaccine was available today, it would take some period of observation of people who've been vaccinated, even if they demonstrate an immunological response that we can measure in a test tube. It's going to take some time to see that when that population is challenged by a virus, they actually have immunity. And until we know that, we won't know with certainty that a vaccine is absolutely effective. So vaccines, I think, are probably a more distant hope, hopefully in the next year to 2 years, but that I think is realistic. Therapeutics, different story. Remdesivir is an antiviral that has been demonstrating very significant gains in improved health for critically ill patients, patients who are very sick with coronavirus, who are in the ICU, for instance. It reduces their ICU time by about 30 to 40%. That's not nothing. That's quite significant, actually. Whether it can show similar benefits in less ill people or show that people who are initially infected don't get as sick remains an open question. And there are a number of other drugs that are coming down the pipeline that will hopefully all do the same thing. Therapeutics will get here before the vaccine. The vaccine is coming later, but all of this is in the pipeline and it will happen eventually.
So now, can we speak about something very difficult? You know, we all think doctors and nurses are very strong, and it's very reassuring for us, you know. But in fact, they are humans. They have feelings, and we applaud them every night. But it's not enough because it's a big stress to go through what they see every day. Can you talk about it?
Sure. You know, you're exactly right. Doctors and nurses and all the healthcare providers that have been taking care of people who've been sick with this virus are human beings, and they all have emotions. They all have feelings. And these have been extraordinary times for everyone, for patients, for their families, and for the healthcare providers. And by healthcare providers, I mean not just the doctors and the nurses, but the people who clean the rooms, the people who provide food service. All of us have been working overtime. We've all been asked to step up in a way that I think I can't ever remember having to do. And this has taken a toll on all of us. It's not just fatigue, and it's not just the job stress. I think there's been a huge emotional stress. Seeing so many people die, seeing so many patients that are so ill and so irretrievably ill has been very hard. One of the members of our NYU faculty, a cardiologist who contracted the virus and was in the ICU for about a month, died last week. So we've had colleagues that have lost their life to this virus. We've seen many, too many patients die from this virus. It's been hard on all of us. And it's emotional. I remember hearing somebody say about World War II that, you know, I wasn't a hero, but I worked in the company of heroes. And I really feel like that. The extraordinary effort that I saw nurses and doctors making on a daily basis during the acute phase of this illness in the hospital was nothing short of amazing. The amount of humanity, the amount of compassion that these people showed on a daily basis, every day coming back to work, doing the same thing again, putting on all that protective equipment, going into these rooms where they knew they could be infected and potentially risk their own lives to take care of other people. It was an extraordinary experience.
So now let's speak about the future of medicine. You had to adapt yourself, you know, to this social distancing situation while staying close to your patients. Do you think it's
Right.
going to be a lasting trend?
Well, I mean, I think the social distancing is here for a while, and we're all going to have to figure out how to incorporate that into our daily activities, including doctors taking care of patients in the hospital. And in fact, you know, you know that in New York State, all elective procedures had been stopped, all ambulatory visits had been stopped, and we're now starting to open the doors again and have people come back to the office. But we're taking a lot of steps to keep everyone safe, patients and medical providers alike. One of the potentially good things that has come out of this disaster, the COVID-19 disaster, has been better access and better implementation of virtual care. So very much like we're talking right now through a telecommunication meeting where we're located in different states, as a matter of fact, we can provide medical care like this with our patients. And I think this has been a sort of a pleasant surprise to everyone. It's tremendously convenient for patients. It's very efficient for the medical providers, and it really, I think, opens a lot of opportunity for us to do something very good where it's a win-win for everybody on a much more prevalent basis. So I'm hoping that the virtual care is something that we can continue to do. A lot of that's going to depend on payers and whether they'll continue to pay for it. But that's one of the few good things that has come out of this entire coronavirus catastrophe.
Thank you so much, Steven, for sharing all those important things with us. And hopefully you'll be back on Startup Vision TV. Thank you so much.
Thank you very much, Florence.